Hi there, my name is Taylor Rosati, and I did my module project on anxiety. I chose this because I personally struggle with anxiety, and I really wanted to learn more about it and what it really affects in my body, in my brain, and I just really wanted to learn how I could control it or what I could learn just for some background on it. The definition of anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something without a certain outcome. So this can basically be anything. It will vary on the person. Like for me, for example, I struggled with anxiety if I have a big test coming up or if I know that I didn't get something done for work. I will get panic attacks or anything along those lines. It's very scary. Anxiety can affect people in different ways. People can have different ways of dealing with it or being attacked by it. It just all depends on what kind of person it is, who the person is, and how they deal with it. Anxiety does infect us eternally. It affects our cardiovascular system, our respiratory system, our gastrointestinal system, the musculoskeletal system, our immune system, and our nervous system. So that is literally all of our bodies. So it's really, if somebody is struggling with anxiety and it is very progressed and bad, it could start leading to problems in the inside of the body, affecting your nervous system where your nerves and everything meet up, and that can cause major problems. And if you get anxiety and it starts messing with your immune system, that would be horrible because that is what keeps you healthy and protects you from being sick. So if anything starts to happen internally from anxiety, it is suggested to get help and try and figure out what is going on in the body. It infects more than just our organs. Anxiety affects the heart. It increases the heart rate when anxiety hits. So when people start panicking, their breath starts increasing, respirations, they need air into their body just because their heart is pumping so fast. People will have a really hard time breathing when they are hit with anxiety, and people will experience sharp pains in their stomachs or even causing diarrhea. Also, people have experienced really intense muscle spasms through the whole body where you're basically just just sitting there and your whole body is basically just twitching and you just can't even help it because you're having an anxiety attack. And that can be really scary. Anxiety is divided into different types. There are 6 different anxiety disorders that people can have. So the first one is generalized anxiety disorder, which is the most common. Obsessive compulsive disorder, panic disorders, phobias, post-traumatic stress disorder, and social anxiety disorder. The post-traumatic stress disorder would be a great example for PTSD for people who come back from war and have very intense, I don't even want to say anxiety attacks. It's more, the PTSD and stuff, and it's just horrible. It can really affect people's lives. The social anxiety is people who get really nervous with being around a lot of people or in big crowds. The phobias is if people are scared of like spiders, or someone has a phobia of like throwing up or something like that. People can get anxiety from worrying so much about the phobias. The panic disorders, that's when people are sitting there just constantly worrying about something, and then they just panic, and that's when the heart rate races up. They can't breathe. They have sharp pains in their stomachs. Obsessive compulsive disorder, that's when people really need things to be in a certain spot. Things need to be done a certain way. If not, it'll set off something in their brain and trigger an anxiety attack. So those are some examples of those. And the generalized anxiety disorder, that is just regular anxiety. That is worrying, trembling, just stuff in your brain that you are constantly worrying about that'll cause you to have an anxiety attack, like I talked about earlier, like taking a test, or, oh, I didn't get this done. Just constantly worrying and thinking about things that you didn't do or haven't gotten done yet. Signs and symptoms can really differ. Each anxiety disorder has different symptoms and signs, but one that stays in common is the constant fear and nervousness. So that is just being nervous and scared about a situation or a certain outcome or something along those lines. Emotional signs and symptoms would be irritability, trouble concentrating, feeling tense, feeling of apprehension, and restlessness. So any of these signs, I mean, they're not horrible, they're not, I mean, nothing too serious, but I mean, the trouble concentrating and restlessness can cause other problems. Like if you have trouble concentrating, you're not going to be able to get work done, or you're not going to be able to concentrate and get a task done that is needed. Restlessness, it could be really hard. It could cause people from not being able to sleep, or just being fidgety and just not in a good mindset or mood. Panic attacks. So these are really common in people with anxiety disorders. They can last from anywhere to 10 minutes to 20 minutes. The longest, I mean, they shouldn't exceed 30 or 40. That's pretty intense. Sometimes with panic attacks, there isn't a known trigger. Someone with an anxiety could just look at a certain something. Excuse me, sorry, my cat just jumped on to my computer. Excuse me, I'm so sorry. Anxiety could just take a certain look. They could look at a red blurb or read a certain word or anything along those lines. People who have experienced anxiety attacks say it feels that they are having a heart attack or even dying. I have experienced this with one of my friend's moms who had an anxiety attack while just reading a magazine. Something just, popped out, and I was too young to understand, but now I do. She just threw the magazine, and she said she couldn't breathe, and it was really, really scary. She was hyperventilating. She was sweating really, really bad, and she said that she did have some chest pain. So it was just really intense and scary just from reading a certain word. So yeah, just again, symptoms of a panic attack: hyperventilation, chest or heart pain, nausea, or hot spells. So it can be really scary. Treatment and prevention. So I'm just going to quote this. Prevention of anxiety essentially involves an awareness of life's stresses and your own ability to cope with them. There is ways to help and prevent anxiety without the use of meds. I am not on any medication, and I've seemed to calm myself down when I do experience anxiety. I have not been experiencing it that much, which is awesome. Living a healthy lifestyle can impact anxiety a lot. Just by eating healthy and exercising regularly, living a regular life, being on a regular schedule, trying not to stress can really prevent anxiety. So ways that could help, people say that taking a visualization of yourself conquering a fear can really help. Like if anxiety is caused by a fear that someone has, it can really help by imagining yourself conquering it. Taking long hot baths with like certain bath soaps, or just sitting in there relaxing, zen, light a candle, just really try and relax. Relaxation exercises include breathing mechanisms like slowly breathing in through the nose and out through the mouth, or just breathing in and out. And that can really help people who are actually having an anxiety attack and need to breathe. Just in and out, in through your nose and out through the mouth. That can really relax the body and make everything kind of calm down. So just treatment and prevention continued. People can go to counseling to help this, but it may not work for everybody. What they might try and do there is, let's see, they could do a combination of different kind of therapies, psychotherapy, or cognitive behavioral therapy, which is just basically they'll talk to you, try and see what's going on, and get into your brain and see what's really happening up in there. Medication is always an option for anxiety as well. There are 4 different types that are usually recommended, but with these specific drugs, they have little side effects except for drowsiness and obviously possible dependency on the medication, which can lead to a bad outcome, but a lot of people can regulate how often they're taking this medication. So people can take Valium, Xanax, Activin, or lorazepam, or Klonopin. So any of those, I mean, you'd have to get a doctor's approval and talk to your doctor about it. And those are for really extreme cases of anxiety. So that's if somebody is having an anxiety attack like more than once or twice, 3 times a day. Probably that seems really extreme. So that's probably when you want to, if nothing else worked, medication would probably be the last option. So there can be long-term consequences and effects from anxiety, but they can 100% be avoided. So anxiety has now been implicated in several chronic physical illnesses, including heart disease, chronic respiratory disorders, and gastrointestinal conditions. So that can be pretty bad if not taken care of, but it can be avoided. So stress hormones are known to cause different types of diseases. Because anxiety can affect the stomach, it's affected through, or I'm sorry, that doesn't make much sense. Because anxiety can affect the stomach, it's affected enough it may develop Crohn's disease. And with this disease, this affects the lining of the colon and causes inflammation. So that can be traumatic. Also, stress can affect with different skin diseases, making skin very painful and not very presentable for someone. And with anxiety, I talked about how your heart increases, and when your heart increases when having a panic attack, that means the blood pressure is always being raised, which is increasing the blood pressure and blood lipid levels. So this can lead to like really bad heart diseases, and it can cause fatty plaque, and it gets into the blood vessels, and that causes bad blood flow to the heart, and that can cause a heart attack, and that would be really horrible and not good for anybody in the situation. But all of these can be avoided, so that's awesome. And these are my works cited where I got all of my information. So thank you for taking the time to listen to my presentation, and have an awesome day. Thank you.